Hello everyone, I'm Dr. Vivek Vardhan, consultant pulmonologist and allergist at SWASA Hospital, Hyderabad. Now we'll talk about inhalers. What are the myths and what are the facts about these devices? So there are a lot of myths that are around inhalers, like inhalers are addictive, inhalers are not safe for your kidneys or heart, inhalers can cause fractures or can lead to loss of calcium, or inhalers can cause dangerous diseases, or inhalers cannot be used in children or infants, inhalers cannot be used in pregnant women. So there are a lot of myths surrounding inhalers in and around them. We today want to clear some of the myths or all of them, along with what are the benefits and uses of inhalers. To begin with, I'd like to say inhalers are absolutely safe depending on what inhaler you choose or your doctor gives to you. That is going to decide your outcome. Inhalers are of different types. One is called as an MDI, like it is like a canister that is there in a plastic bottle where you press and the medicine comes out. This is one type. Other type of inhaler is a dry powder inhaler, where you have a device and a capsule, the main capsule. This capsule has the medicine, so it's like a dry powder, so you call it a DPI. You put this medicine in an inhaler and use it. So I will demonstrate how to use inhalers or how to use DPIs later in another video. But now I would like to tell you that these inhalers, whatever type they are designed to go into your lungs, just into the lungs through your mouth. So inhalers, when used, enter your lungs through the air, along with the air, and they get distributed in your lungs. So lungs is basically like a tree which has a trunk or like a stem and a lot of branches. So this main trunk is the trachea, which divides into two huge branches called as bronchi, main bronchi, and which further divide, just like the branches of a tree, into thousands of branches. So these branches look like this, more or less, because as they go to the tip, the branches will become more narrow, normally also. So these are supposed to be like this. You use inhalers in diseases such as asthma and COPD, where the tubes are getting blocked. So you want to open them. So that is why you're using these inhalers with the target to open these tubes. So just like the leaves of a tree, there are something called as alveoli. Just like bunch of grapes, there are like bunch of grapes around all these branches. This is where the gas exchange happens. There are some diseases which affect this part, and there are some conditions, especially COVID, where you're supposed to use an inhaler, which will go and affect that part, and it will cause some benefit. So inhalers are used in a wide variety of diseases, especially airway diseases like COPD and asthma. This video is being made in an attempt to clear the myths. So is inhaler safe? Yes, inhalers are safe. Inhalers are in micrograms, not even milligrams. So it's like taking a tablet, splitting it into 10 to 100 pieces, taking a piece and spraying that piece. So that is one piece. So that is in micrograms. So when you inhale that, almost half of that will be deposited in your mouth, and only rest of the medicine goes into the lungs. So this medicine has to be cleaned after inhaling by putting water in the mouth, gargling and rinsing mouth and throat. You have to remove the water and drink again. So this way, in the puff that is delivered, almost 50% of the medicine is already out of the body, and only 50% that goes to the lungs, which is a major part where it acts, so shows the action. And to the blood, it is very, very, very minimal. It may or may not get absorbed into the blood. So that is where it goes to other organs. But inhalers as such are very negligibly absorbed from the lung. So they are very safe relatively compared to tablets or syrups or other powders, because they go through the mouth, into the stomach, to the intestines, they get absorbed into the blood. That is where it circulates all around the body, and in that it will reach your lung and shows its action there. So this is a tablet or a syrup where it goes to all other organs because it is eventually absorbed into the blood. Whereas inhaler is not like that. It is first going to the main organ, that is the lung, and later on sometimes, that is in very, very minimal quantities, may get absorbed. So literally side effects are almost negligible. When used in a proper dose, obviously, any medicine used beyond the required dose can be a poison. So the required dose will not cause any problem. Can inhalers cause kidney damage or heart damage? No. With the doses that we prescribe to you, even if you finish an entire canister in a very early period, it will not cause all those problems like liver damage or kidney damage or heart damage. It won't cause all that. Inhalers are relatively very safe. So whatever you have heard about that is not correct. That inhalers are bad for your kidneys. No, inhalers are very safe and they don't cause any diseases as such. And inhalers, there is one more question. Are inhalers dangerous for your bones? Usually not. Sometimes when used in a very high dose, sometimes they may affect your calcium metabolism or may cause something called as osteoporosis. But 99.9% of the times when used in a normal dose with a regular dose for a right patient, it won't cause any side effects to your bones. It doesn't even reach there. So right inhaler to the right patient in the right dosage at the right time will give the right results and will avoid side effects. One more question is, can inhalers be used in kids? Of course, the type of inhaler depends. With a very small dose, yes, you can use even in infants, that is less than 1 year olds, when required for asthma or something called as viral wheezing, where I prefer inhalers over nebulizers. So inhalers are relatively safer than them, and of course safer than other orally administered medicines. So they are safer in kids depending on the type of disease and the dosage of the inhaler. Next question is, are inhalers safe in pregnant females? Pregnant women, is it safe? Yes, inhalers are absolutely safe in them because depending on the type of inhaler, a particular molecule is absolutely safe in pregnancy, and it will give very good relief to the mother, because the mother is already suffering with breathing difficulty in her last trimester because of the baby bump. She will feel breathless, and if they have asthma upon that, it will further worsen. So using inhalers in pregnancy, a particular type of inhalers, is very safe and can be used, and this will prevent any exacerbations or attacks in the mother, and also it will not cross the placental barrier. It won't enter the baby, so it is very safe. On the other hand, if inhalers are not used, sometimes asthma, with severe asthma, it can cause intrauterine growth retardation, that is IUGR, in babies, where you have smaller babies, and they may further have some complications. So using inhalers is any day safe in pregnancy. So inhalers are safe in infants, children, teenagers, adults, elderly, and pregnant females. All these age groups, anybody can use inhaler. Depending on what inhaler you use, you get the best results. So to get the best results, consult a very good pulmonologist who can diagnose the disease and give the right inhaler for you. Thank you.